I'm Dr. Dighton of Loughton Clinic and Loughton Cardiac Centre, and I want to tell you today about how lives can be saved by screening people. The salient fact here is that 95% of people with heart disease or oncoming heart disease don't know they've got it. Because the heart has got fail-safe mechanisms in it, it will perform even when it's in trouble. So at the very end of its elasticity, as it were, it's still working before it snaps. Now, when it's about to snap, it doesn't actually snap of course, but when it's about to give out, there are certain symptoms. And the most important ones of those, which are non-specific, are breathlessness, getting more and more breathless week by week, and tiredness. Now, of course, tiredness and breathlessness can occur in overweight people, elderly people, unfit people, all sorts of reasons, least of which may be heart disease, but these are the sort of cases we're looking for. We're also looking for people who might have a family history of heart disease because they more commonly have heart disease or coronary artery disease themselves. So what can we do to find out whether or not you have heart disease? Well, the best test of all really is to sit and talk to a person and find what their family history is and their history is, examine them, and then do a few tests, the most important of which I have found to be the screening of the arteries to see whether there's furring going on. That's a process called atherosclerosis. It kills most people in the Western world in middle age, and we scan your arteries using ultrasound. We can also do your ECG, but that's a bit lame in early disease or very early heart disease. That can be completely normal. Even an exercise ECG can be normal in very early heart disease. But once we identify you as a furrer of arteries, then we will go on and do further tests like a CT scan of your heart, or if the exercise test is positive, we can then do an angiogram. But the most important thing to save life is to be aware of oncoming breathlessness when it seems out of context, chest pain of course, because some people will get chest pain, most of which in a clinical setting is not due to heart disease, and increasing tiredness which seems out of proportion to your health. Under those circumstances, you can do one of these tests, see whether you're a furrer, see whether your heart is functioning normally before you get angina and before you get a heart attack. Please think of it not only in yourself but in your relatives and friends. If you see these things happening, advise them to get tested.